won't be going into so much detail, but would like to hear from him the experiences and the message what he wants to deliver today. Please, Dr. Atulabh Vajpeyee.
Good afternoon. Thank you very much, sir, for such kind words for me. So, I welcome you all at the realm of journey of spiritualism and healthcare. For next 20-25 minutes, we'll be talking about this. I mean, this is interesting because it is because of our spiritual practices. You know, you have imprints on your brain which are called habits or sanskar. So I thank and congratulate these four souls who conceptualized this whole meeting, and that's what we are here today for. So basically, I have no conflict of interest for this presentation for sure. Before I start, it's very difficult, especially to teach medicine, where you teach that how not to take medicine. So moreover, it's for a clinician, it's very difficult to treat. But these are certain things. I'll be like sharing you my talk under following heads. I'll introduce you to some of the words, definitions. Patient, because our whole endeavor is for patient care. So how do you assess spiritual need of a patient? At the same time, you should be sure about your own spiritual needs and personality, and of course, you don't miss caregiver here. Well, then, what is the science behind spiritualism? Because we all are scientists, so we need to have medical evidences, be it in the form of EEG or imaging or neuropsychological testing, and our own work in the department from last few years about this, and what could be the future direction. This is an interesting publication from Lancet last year. So they assessed spiritual need of Danish patients. This was a study of more than 1 lakh patients. So very interestingly, spiritual need which came out from patient side, that what exactly you feel was missing in your care or what was devoid of that. So anyway, I will not be going in details of the patient, but this is how important this is, because as we all know, right from the time of graduation, we read that health is a state of being mentally, physically and socially fit, not merely absence of disease, that we all know. So WHO itself has added the 4th domain, that's spiritual domain. So spiritual health is also considered part of health nowadays. But when you look at definition of spiritualism, it differs from person to person, from place to place. It's very difficult at times. If you look at Oxford Dictionary, it is something like, they call it spiritualism means what in Hindi called pretatma, means a dead person talking to a living person through some special people who are empowered with some special powers. So that's not precisely the case we are here for. So this is spiritualism in that dictionary. Our own Indian context, spiritualism means आध्यात्म. आत्मा से परिचय और खुद से परिचय अध्ययन के द्वारा ही आध्यात्म है. सो हमारा जो आध्यात्म है वो शायद वेस्ट के आध्यात्म से अलग है कई मायनों में, बिकॉज हमारे आध्यात्म का मतलब है the one person is doing daily activities in such a manner that he is trying to realize full potential of himself and his or her nation. So we need to understand, before we understand that, so what are the spiritual needs of our patients or caregivers for that matter and healthcare professionals? Well, we all have to, we always worry whether we are in normal state or we are in some kind of illness. I mean, of course, it will differ. A person who has a terminal illness and somebody who is suffering from a treatable illness. So the spiritual need of a person could be what is purpose of his life, meaning of his life. He wants to be loved, He wants to have a sense of belonging. He wants to have, a sense of peace, happiness, and joy. So that is something, this is very interesting, I read when I was reading Hutchison textbook of, medicine, that you hold a hand of a female, a 80-year-old female, with your hands and talk to her for 5 minutes. This will actually heal her more than what you do for her as a treatment part. So that's very much known thing. Many times spiritualism is beyond religion. But for certain people, religion and spiritualism are same. And that's not also wrong. Because you have to really, because this problem, it happened 20 years back when I shifted here, because I was dealing with stroke and intervention. I mean, when I started neurointervention in this zone, the problem for me that nobody was ready to accept there is something called angioplasty and angiography in brain. So people were not taking it. And most of my patients were not in hospitals, but in temples. So that's how I could reach out, because faith was already there. Avri Mata temple is the biggest temple in the zone where you have maximum number of stroke patients, and you care there is much better than many other places, many other hospitals also, because they have devised physiotherapy in a manner that at some places patient would go sitting, crawling. So fantastic physiotherapy is already there. So they were getting benefited, and moreover there was faith. So faith drives healing. So they were doing a better job. So many years that was the most sought after place. So you have to reach out to them. Then you give me that golden hour or initial time period, and then of course, so you have to combine faith and religion at times to derive better results. So this is how we approached, and fortunately we were able to treat their chief priest also with stroke, and they allowed us to do awareness camp right inside the garbhagriha of the temple. Well, so there are various tools. We as a doctors, patients, caregiver, how do you meet your spiritual needs? Somebody may like spending time with friends, going to nature, doing yoga, meditation. So all things can, satisfy your spiritual needs. So the different needs for different people actually. So what I am here trying to tell, in our wards, in our ICUs, the patient is not spiritually well. So that patient will refuse care. He will be agitated in neurology, in psychiatry, and in many other branches. This is a very common problem. He's not ready to accept your treatment also. So he's very restless. He's at unrest. So peace is not there. Happiness is not there. So spiritually he is disturbed. So we need to look from that point of view also. You do a simple analysis. It's hope. What are the sources of your hope? Like your strengths, your sources of peace. A simple question you ask from your patient: do you have or do you follow any organized religion? Because some people who follow religion and they are very pure and pious, they follow good things of the religion. I am not talking of other things. So somebody who is very religious in true sense would have spiritual needs, and you need to satisfy them so as to derive to a complete health, which WS also endorses now. Do you do any personal spiritual practices? Like, do you do any yoga, meditation? So that is something you can ask. And what are those effects in your life? So that is something your patient can be missing. And if you are want to do a detailed analysis, this is what we use in our study: spiritual quotient. Spiritual quotient, or SQ. So this is a scale of 0 to 96. I'll not go in details of this test, but that is something you can do, to derive, because you all know. If I ask you what is IQ, you will do, bachelor's, adult, or pediatric intelligence scale for IQ. If I ask you EQ, my psychologist or psychiatrist would tell you there are EQ scales also. But if I ask you IQ today, SQ today, as a medical practitioner, most of us are not aware of what is SQ. And why this is important, I'll tell you. So I come back again. Yoga is nothing but it's a tool to derive or to reach to that spiritual health. So yoga means it's combination of air breathing, that's what you call pranayam, physical postures, that's what you call asanas, and meditation, that is dhyan. These are three basic components of yoga. Apart from that, of course, yoga includes your diets, what they call yam, niyam. So all those things are described. we really don't know. Yoga started in India, that we know. 5,000 years back, I don't know, 10,000 years back, they say it's Patanjali, because we all are aware of Maharshi Patanjali. He described that Yoga Sutra, but it is said that probably Lord Shiva was the first yoga guru. So then it started, we don't know how many years or decades or centuries back, but that's a different thing for history. But it did start in India, and these are certain, Ashtanga Yoga was very popular, and it has that 8 rules to follow. So basically, on background of this spiritualism, how we as a medical practitioner, first of all, we need to be convinced. How does it really, work? It is all in some of our ancient books, or it has some practical application in our day-to-day life also. So basically, when I was looking for this, I found that brain and mind, these are two different things. Brain is something whole my life I have been just working on brain, plumbing in the brain, cleaning the arteries, giving pills, all these things. Mind is something you don't see. Every day more than 6,000 thoughts would go across your brain. So some of these thoughts, like good thoughts, some would be bad thoughts. मैं ये करूं, नहीं करूं, ओके मैंने ये कर लिया. कल भी वही विचार आएगा मन में, ये करूं कि नहीं करूं, इस पेशेंट का ये था, ये करूं नहीं करूं. विचार किया, जब आपने 10 बार ऐसा किया, आपना एक पैटर्न बन गया, तो then your conscious mind will not worry. Your subconscious mind will take decision and you will do that thing. This is what you call habit or sanskar, which is the topic of this seminar, the susanskar. How do you develop susanskar? So you have to inculcate this right at the time of graduation, and this is precisely what my teachers have been doing. By the ways at that time we were not even realizing that that's how they were doing it, and probably same thing needs to be instilled in younger generation today. So there is a basis for spiritualism, and what this is called neurotheology. After neurointervention, this is not very old, but my recent interest is in neurointervention. After neurointervention, neurotheology, that's a spiritual aspect of brain. Ultimately, it is brain which governs everything in our body. Well, very simply, if I put it this way, you have right and left hemisphere. Your left hemisphere is, controlling your reasons, rationality, logic. While right brain is faith, innovations. So I follow this particular person or religion, that's your faith. So, as to say, if I put it in another words, faith is something which is working on subconscious level all the time. It is already imprinted in our brain. Reason you have to, every time you have to have a reason or logic which would be different. Today my reason of coming here or your reason of coming here would be different, but 5 years down the line it will be different. So what I am trying to tell you, the left brain which governs your logic, and right brain, so what happens? Left brain, reason, logic, intelligence, IQ is developed. So your IQ is determined by your left brain, and that's more or less genetic. You can improve your IQs to some extent, but you can't, a moron cannot be super intelligent. So that's how it is. Well, right brain, faith, innovation, it has no boundaries. Right brain, I'll tell you later, this is spiritual brain also. Why I'm saying this? Because when you think, most of us are sitting here, so right brain will govern your emotional quotient, EQ. You can again measure it. First, you have something where you have synchronous working of both hemispheres of the brain. Your corpus callosum connects them. That is the highest level of intelligence you can develop. That is what you call spiritual quotient, which I'll come again later. But believe me, when there is a conflict between faith and logic, it is usually faith wins. When there is a conflict between scientist and a religious person, it is usually the religious person will win. The scientist will not only lose, sometimes he will lose his life also. So this has been history. So this is how, let's give some other example. Why I am saying this? I know अंधेरे में जाने से कोई फर्क नहीं पड़ता है, अंधेरे में कोई आपको नुकसान नहीं करेगा, but there is complete dark. Somebody who is afraid of darkness, he will not go. I know if I go by flight to some place, I will not die. Accident does happen very rarely. But somebody who has a fear of flying high will never go. So it is imagination that wins. It is your subconscious brain that wins. So what I'm trying to make a point here, that if you combine faith and logic, conscious brain and subconscious brain together, this is what makes your spiritual intelligence, when there is synchronous processing of one's brain. Well, so this is highest form of intelligence, but how does it help? Because this will activate capabilities in the soul in the form of you derive or develop wisdom, compassion, joy, love, energy, and peace. So this is very important for one's life. What happens if I have a higher spiritual quotient? Personally, I'm happy from inside. I'm peaceful from inside. When I come at my family level, I will stop avoiding small things. छोटी छोटी बातों पे मनमुटाव नहीं होगा, तो your family life will be better. When you come for work, which is usually a daily core of earning money, even for doctors also, we work day in, day out, But when you have higher spiritual quotient, your workplace will become, it will become a place of joy. So this is how spiritual quotient will develop. If you look back at history also, the brain has history of 100 million years. So as we have all 100 million neurons also in our brain. In evolution also, if you look back, it was initially a reptile brain, which is territory brain, which is olfactory brain. So this is right, brain developed. The first neuron emerged in seawater, in ocean. It was just, a neuron surrounding ocean water. That was in fish. We all read in biology textbook, Amphioxus was the first fish where brain was there. Just a single neuron surrounding seawater. Reptilian brain is territorial brain. If you don't encroach in a territory of a snake, he will not bite you. But if you go inside, he has just this much brain, he will bite you if you encroach in his territory. Then came limbic brain. Limbic brain was a brain which perceives, hatred, love, and all these things. So many animals would also have, affection to their kids. They would rear them and they will take care of them. So that was a limbic brain. Then what happened? What I'm trying to show you here, this is our new brain, neopallion, which we human have. So in today modern neuroimaging will tell you all parts of new brain, old brain. Maybe that would be beyond this, but this new brain, this has developed these things which are responsible for spiritual quotient. That is only in human beings. Well, one of very interesting case I will show. One point of time I was dealing with a young male with a hemiplegia, and there was tight carotid stenosis with middle cerebral artery also occluded. Young patient, I did an angioplasty. I was happy end of the procedure. Everything was nice for me. Things were okay. I shifted him to ward next day. Clot was removed, and the patient at that time, one of my fellow who came from Bangladesh, was with me on the rounds. He was speaking something. This was, I cannot pronounce, Ammikus Sharda. I mean, those who understand Bengali, they would understand that. So I actually did not. For me, it was neologisms. He is speaking something which I am not able to understand. So I thought it is some complication after my procedure. He was okay. He was speaking well before the procedure. Now he developed some complications. So I just did not pay much attention and waited. And at some point of time, that recovered also. I really do not know till I read this article that probably the boy, sometimes you develop new language also. So these are the things which are not explained by science. So he was very sure that he spoke few words in Bangla, and he never had any background of Bengal or Bangladesh. That patient was right from Wagad area, from here. So basically these are the things which were not answered in that time also. And this is what I'm trying to make you aware of. This is your spiritual brain, that is parietal cortex. I'll tell you why this is called spiritual brain. So basically this is, I'll not go in details of this is brain. Primarily, our limbic system is something which is emotions. Limbic system is all about emotions. Parietal brain, because we all read, what is function of parietal lobe? Orientation to time, place and person. Medicine teaching is classic. I suppress my parietal lobe by any kind of practice, I will lose orientation to time, place and person. You are sitting there, I am here, there is me and you, there's a dichotomy between two. I lose this dichotomy, I'll feel one with you. So what happens? Frontal lobe lights up, you have concentration, parietal lobe suppressed down. So whatever I'm saying, I'm trying to prove it, in studies we have. So you feel one with the world. So that is the zenith of, we have GCS, we have Glasgow Coma scale. Otherwise we have, either I'm awake or sleeping, and in between there is altered sensorium. But when you go to yogic GCS, they would have, so this is highest level of spirituality you can attain when you are one with the aura of being one with the world. So where various part of this brain will respond to different images, and this I will just skip all these things. So as I said, this is very important. There are various spiritual experiences by and large have something in common. They are intense. Once you start doing spiritual practice on every day, they are intense, they are clear, they develop a sense of unity to the world, they give a sense of surrender, and finally they become permanent part of your life. So this is through repetitive practice. There are various kind of spiritual experiences. Again, and mind you, this is beyond religion. Every religion had this component of spiritualism. They had different ways, and so this is again, I have just tried to look into various religions. I mean, how do they do spiritual practice and what are their goals? So this is yoga was popularized in US because the hot yoga was used for stopping smoking at one point of time, which was very rampant there. So this is how Christianity, this is what I was telling, absolute unitary being, AUP. So, well, these are present evidences we have. If you have, some flashes of light kind of thing, somebody is seeing. So he is probably spiking in his occipital lobe. We all know occipital lobe is responsible for vision. If somebody is passing through a tunnel, again there is spiking in brain. So the best thing is, if somebody is saying I have done this spiritual practice, so what are the evidences? We can have evidence either through functional imaging, functional MRI will show, or a EEG can show, or a psychometric analysis can show. So these are various waves in EEG. Again, I'll not go into details of this. So these are three techniques you can. So these are this is functional imaging. Images at baseline and during meditation. So this is baseline image, you see, and this is meditation. So what you see red all here is active area. This parietal lobe is active here. When you do meditation after few weeks, this goes down. So your activity in parietal lobe is less. At the same time, what happens in the frontal lobes, in the front, it lights up. There is more activity. So more activity in frontal lobe, suppressed activity in parietal lobe. And at the same time, there are something called dopamine, serotonin. These are happy hormones. So the spurt of these hormones, again, they are chemicals in your brain, which creates all these feelings through various pathways. Interestingly, this is what article I read. And then I realized I was treating with this Brahma Kumari people. Actually, I have treated at least, more than 200 patients of Brahma Kumari with Parkinson disease. First of all, I was very curious because all over the world, they would consult me online also, not those here in Abu. But interestingly, what they do, they handle Parkinson better than normal population. I was using very low doses of Syndopa and other things. They were responding very well. So that was something which was interesting. Then I realized they do meditation and yoga for years altogether. So their dopamine receptor goes down. Dopamine uptake receptor goes on. This is one of the study I found. It was in response to some medicine, but probably the dopamine receptor uptake goes down. There is more dopamine in brain. So they do pretty well on lower doses of Syndopa, and they don't require add-on medications many times. So they handle Parkinson very well. I don't have any. This Kirtan Kriya was one of the, this is from Sikh religion. So they do Sat, Nama. So there is mudra and chanting. With this 8 weeks exercise, Alzheimer's scores improved. So again, this is a published paper, and they did SPECT study. This is our own study in COVID time when there was not much here in Pacific. So here we did a one hour module of music, which we took a classical music clip along with yoga, and we did at that time we just did a DES-42 scoring, that depression, stress, anxiety scoring, which went down in people who were suffering from stress, anxiety, depression, and also in people who are not suffering. So the score improved across normal population as well as those who are suffering from it. Okay. So this, after that, then we thought that we'll plan, proper study here. So then we took actually, we made a 1 hour module of yoga that included meditation, pranayam, along with asanas. So 1 hour along, we did not include music at this time, and then we looked at some robust parameters. At the baseline, that was DAS 42 score, which was easily available, so we did it. And then Oxford Happiness Quotient that we did. We looked for IQ changes, we looked for emotional quotient changes, we looked for SQ changes. So IQ, we had WES in psychology department at that time, which is very costly tool, but we could get that WES test at that time. So after intervention, in most of the studies, it was for 12 weeks, 3 months. 3 months, there was improvement in all the scale except for IQ. EG, as I showed, before and after, there was more buildup of alpha. We are all learning alpha activity is an activity of rest in mind, 8 to 13. We mostly are in beta state of activity, which is 13 to 20. We are working, thinking, or beta activity. So alpha activity build up after 12 weeks of intervention. That's by doing yoga. So what I was trying to tell you earlier, that parietal lobe goes down, frontal lobe lights up. So this was reflected in EEG changes also. At the same time, we measured serotonin and dopamine in some of these patients before and after intervention, and there was, so every time we included 3-fold rise we considered as significant, and 4-fold change in any psychometric indices we considered significant here. And these were again psychologists when they examined family relationship, health, fear of death, purpose of life, spirituality. So all these tend to improve. This was protocol what we use, so that's already published, and that you can refer, and somebody who wants to use it in their daily life, they can use it. Well, going beyond that, being a clinician, so what I realized, when you are doing yoga thing, then you have certain diets also prescribed there. Routinely, some of the ingredient in diet also we looked at. So something called super drug in our literature, in ancient literature, super drug. So what is super drug? Super drug is it's turmeric, haldi. We all eat it day in, day out. So I was always thinking that all the coronary events, all the strokes, you have some kind of plaque inflammation, plaque ruptures, and you have an event. It goes in the brain, you have stroke. If it occludes your coronaries, you have heart attack. So missing link, even for surgical wounds, they would apply some dressing, sumac, that is also made up of turmeric, if I am not sure, surgeons would correct me. So the inflammation is visible there. So they are using it and they are taking advantage of this. That inflammation is not visible to you, so you are not knowing it. And none of the treatment in coronary artery treatment or stroke has anti-inflammatory medication as a standard medication. So this was one thing. So if you take a permission from DGCI for a standard, medical trial, it's impossible. These days. So turmeric is already. So that's a small trial we proposed, that we use that anti-inflammatory, because how we can measure it? For us, we have fantastic MRI. So we have already done earlier study which was published in Stroke in one of the leading journals in the world, that plaque inflammation, it is not the degree of stenosis which results in strokes. 20% stenosis, patient may have a stroke. 99% stenosis, he will be lifelong fantastic, perfect, because plaque is stable. Nothing is going to happen. So plaque inflammation is important. So you do a plaque imaging at the baseline, then at 12 weeks, do intervention, give whatever. This is ongoing trial. Maybe I'll share next year this result. So this was one thing came. Another thing which already we published about diet, hygiene. When we did this, when we were retrieving thrombus sample from middle cerebral artery, which is blocked and results in stroke, standard of treatment now, in 24 hours, a patient will come, I'll take him to cath lab, do an angiogram, take the clot out this procedure is so common nowadays, it's still going on in the cath lab. One of my fellows is doing, I came here. So basically you take these thrombus samples, subject them to new generation sequencing. Surprisingly, we found so many bacteria. It's a sterile compartment, they were not contaminants. So, those from microbiology, you'll be astonished. Culture will not tell you, but NGS will pick up any possible single bacterial DNA also. So the whole idea is how do, and these are all commensals and low-grade virulent. They were not Pseudomonas aeruginosa type of infection which was virulent. They were all low-grade or commensals which were living in our oral cavity, on our skin or gut. So they were like that. If it is Streptococcus hominis, Pseudomonas fluorescens, it doesn't really lead to illness in a complicated. So anyway, that's a different thing. So we published that also, and we proposed certain mechanisms. Lactobacillus. So we proposed that lactobacillus creates a acidic milieu in plaque environment. LDL oxidation is 100 times faster, build-up of more cholesterol plaque, and probably. So these are all hypotheses, but this is published. So what I am trying to tell you, apart from standard risk factor of hypertension, diabetes, hypercholesterolemia, smoking, sedentary lifestyle, responsible for stroke, heart attacks, probably there is additional risk factor called vidra. That's lack of hygiene sometimes, which can culminate in stroke. The bacteria will sit in carotid plaque or coronary plaque, live there for years altogether. How does it lead to plaque rupture at one point of time? That's something you can refer to this paper and find out. But the idea is, what I remembered, in the last, sir, you were there? Dr. K.C. Jain Saab, my professor of medicine, he was giving example of his professor of medicine, right sir? Shurbir Singh ji. He was saying that at that time, so many years back, like 40 years back, they used to keep a Dant Manjan in medical ward. That's precisely what he was saying, sir. So I took this picture. I did not know. So they knew it. Probably the dental hygiene has something to do with stroke or heart attacks. That time they knew it, but there was no scientific evidence to prove or disprove that. And it just. So now we have scientific evidence to prove the old same thing and derive to this conclusion. So that's what the paper was in neurointervention. What makes carotid plaque vulnerable? Interplay of microbiota or stress, because stress has mechanism to produce all these events, or it is natural cause of atherosclerotic disease. But I am not deviating from the topic. The whole idea was vidra, hygiene. Again, this is described as one of the niyam in yoga. So yoga is a tool where you have it's a comprehensive system to enhance your spiritual quotient. So that's what key message is. Okay. So as I say, I always believe that by brain, you use 10% of your brain when you are doing routine things. It is something like that. I tell you, I give you 10% of your salary, and I ask you, you run your home in 10% of your salary, how miserable you will feel. So if you are living on 10% of the brain, it's ordinary routine life we are living. But suppose if you can increase this to, let's say, 40-50%, then what are the tools? No drug, nothing else. It is you have to enhance your spiritual quotient. So tools, the simplest is no drug. It is simple, not FDA approved, but effective medicine. So that's what I was telling you. We as a clinician or doctors, most difficult thing for us to teach is how not to use medicine. So that's the message. So you enhance that spiritual quotient, and then you can really. So I think I would finish here. Any details or comments, you are most welcome. The whole idea of this talk was to include spiritual need of your patients, enhancing own spiritual quotient, so that not only you can derive better life for yourself, but for your patients also. Thank you very much.
Thank you very much, Dr. Atulabh Vajpeyee. It was a